I am Laura Anderson, and today I'm going to be doing my informative speech to you guys, and it's going to be about epilepsy and seizures. I want you guys to close your eyes and think back to a childhood memory that you guys really love, whether it was going on a fun family vacation, going on a really fun field trip during school, or attending a really fun birthday party. Now imagine not being able to remember any of those memories you had as a child. Personally, I experienced from this, and it sucks. People who suffer from memory loss usually are affected by a disease of epilepsy or of seizures. Seizures are caused by an abnormal electrical activity that occur in the brain. They have been known to go way back in history of time, and it was believed that in 400 BC that if a person suffered from an epilepsy disorder, they were to have the presence of a demon within them. Well, I can promise you that I don't have any demons within myself, but I have suffered from the many different types of seizures and the different causes and the different symptoms too. So today I'm going to educate you all on the different types of seizures, the symptoms, the causes, and the diagnoses and treatments of them. There are many different types of seizures. They are broken down into focal seizures and generalized seizures. There are even two types of focal seizures, simple and discognitive. Simple and discognitive are very similar. They are usually called warning seizures. People usually tend to have a certain aura of them. When they start to come on, they usually have mental confusion, they start having memory loss, repetitive motions such as rubbing the hands. They might be found walking in circles constantly or even just constantly swallowing. While there are many different types of generalized seizures, the most important and the most serious one is the grand mal seizure. This is the one that I personally have suffered from. People that tend to have these seizures suffer from a loss of consciousness. Their body is found violently shaking. They might lose control of their bladder. Their airway might start to close, and they might start turning blue because they're not being able to breathe. Most of the time they are awoken and they don't have any recollection of the seizure ever happening. I myself have suffered from that one, and also the atonic clonic seizures as well. As there are many different types of seizures, there's also a lot of different causes of seizures. Some of them can be found due to health conditions. People with really low blood sugar can suffer from seizures. People with extremely high blood pressure can fall into a seizure. Other things such as fevers, choking, and even having a stroke can fall into seizures. Strokes are the main cause of seizures in patients over 60. Other things such as head trauma can be also very common symptoms or causes of seizures. Brain infections such as meningitis, a major blow to the head such as falling to the ground and hitting your head during a car accident, a brain injury such as the lack of oxygen getting cut off to the brain during birth, and even a brain defect such as a tumor. Other things that can cause seizures too are anyone that is over 60 and with Alzheimer's. The genetic makeup that you were just born with can form a epilepsy disorder, and patients that also suffer from alcohol and drug withdrawal are very common and susceptible to having seizures. The symptoms I have mentioned very briefly on, people usually start to get really dizzy right before they have a seizure. Their vision might change. They usually tend to start getting a really bad headache. During the seizure, they have loss of consciousness. They might be clenching their teeth, they might be biting their tongue, they might lose control of their bladder. And afterwards, they are going to probably suffer from memory loss. They might have digestive problems, and it also can increase the risk of heart disease. The diagnosis of seizures and epilepsy can be done in multiple ways. One of the most common things is a neurological exam. The doctor can just test your behavior, your motor abilities, your mental function to see what type of disorder of epilepsy you have and the type of seizure you might be suffering from. Blood tests can be done to see if you are having any infections or any genetic conditions. Multiple radiology exams can be done. The two most common ones are usually an EEG, where the doctor will put electrodes to your scalp, and the electrodes will read the brain waves, the electrical brain waves, and it will tell you if there's any abnormal activity in the brain. Another very common one too is CTs, where it uses X-rays to view images of the brain for any abnormalities. This can detect tumors, bleedings, any cysts that might be going on as well. The treatments that can be done, I personally have experienced the medication. This is where there's plenty and different medications that people can be put on. Over time, they can be weaned off the medications and the seizures usually stop. Surgery can be done on the brain if it doesn't affect the major functions of the brain, such as motor skills, hearing, listening, vision, anything like that. Certain therapies can be done, And also on children, a ketogenic diet is usually done, where instead of taking instead of taking carbs, it breaks down fats and uses that as energy. So there are many different types of seizures. There are many different symptoms and causes and treatables that can be done for seizures. I never thought I would be personally affected by it, and I am for the rest of my life now, and it can happen to anyone, but the prognosis of symptoms in epilepsy is really good, and people usually live to go on and live happy, normal lives.